everyone, welcome back to our another YouTube video here in our channel, where we bring you the latest in health and medical insights. So today, we're diving into a specific, should I say, we're diving into a topic that affects many of us at some point in our lives. So these are the fractures. So we'll be exploring the different types of fractures. So from the common to not so common, uh, getting a better, understanding of how they happen, what they look like, and how they're treated. So whether you're a future nurse, just like me, or just curious about your body, you're in the right place. Okay, so let's jump right into the video. So first, we're going to talk about, you know, uh, going to present you what first is a bone fracture. So, a bone fracture is what doctor says when a bone gets cracked or broken. It's kind of like when your phone cracks, but instead of your screen, it's your bones. So this can happen if you take a nasty fall or get hit really hard by a car, or have some sort of accident. So in simplest term, a bone fracture means your bone isn't in one piece anymore. It's like your bone had a little breakup with itself. Yeah, so any bone fracture requires prompt treatment and should be examined by a medical professional. When you break a bone, the doctor does this thing called setting. So they are setting it. So it's like they're playing a game of bone puzzle and putting the pieces back where they should belong, or where they should be. So this way your bone can heal up properly, and you won't end up with a crook or wonky bone. Yeah, so if a broken bone doesn't heal up right, it can lead to a big two problems. So first, what are the two problems? First is your bone might end up crooked. Like not fitting together correctly. So second, you could get an infection in the broken area, which is not fun at all. So it's important for your bone to heal up the right way to avoid these issues. So going without treatment can also cause, permanent damage to nerves or muscle tissue. Bone fractures can be described by a number of terms. So yeah, so you might have heard of this thing called closed fracture. So this will be our first type of fracture. Okay, so it's called closed fracture, and you're probably wondering what it's all about. So well, no worries, dito ako dahil dyan. So madami pa tayong pag-uusapan. Madami pa tayong itatakel na types ng mga bone fractures. So a bone fracture can be open or closed, right? So this can also be called compound or simple fractures, respectively. So pwede nating tawagin ang, closed fracture na simple fracture. Okay? So simple fractures. So later on, matatakal natin yung dyan sa next reporter. Okay? Matatakal natin yung open fracture. So ang itatakal ko muna ngayon is open, and mamaya may isa pa. Closed fractures. Okay? So, a closed fracture is just a fancy medical term for a broken bone. But the cool thing is that it's not just any kind of broken bone. So, it's the kind where the bone snaps, but, the skin stays intact. So, imagine you've got your favorite candy bar. Okay? So, okay. Sakto meron akong candy bar dito. Okay. Let's just say this. Is this a candy bar? Okay. This Chocomucho. Imagine, okay? Just imagine. Imagine you've got your favorite candy bar. So, inside this wrapper this wrapper is your skin, right? So, the candy is broken. Okay, let's break this. Okay, so now it's broken, but the wrapper is still good. Okay, the wrapper is still all good. So, no open wounds, no exposed bone, and definitely no bones sticking out. So, sira yung bone mo, na-fracture siya, pero hindi siya lumalabas. Okay? Ganito. Yun lang, simple. So, these fractures can happen for all sorts of reasons. Maybe you took a nasty stumble, had a sports injury, pag nagbabasketball, hindi natin maiiwasan yan. So, or baka ano naman, baka, little accident lang. So, the key is that the bone's broken inside your body and you won't see it poking through your skin. So, that's just basically it. So, you might feel some pain, of course, this fracture, and see some swelling, and your bone could even look a little bit funky, but it's all contained under the skin. Okay, so na-explain ko na kanina. So now, what's really important when you have a closed fracture is to get it checked out by a doctor. Okay, so they'll do X-rays and other cool stuffs to see exactly where the bone broke and how it's positioned. So sometimes they might need to gentle realign the bone back into the place where it should belong. So which is kind of like fixing a jigsaw puzzle. So a closed fracture can still damage surrounding soft tissues, and this results in fracture blisters. So this can form within 2 days if the injury is left untreated. So there you have it. Closed fractures are like broken bones that stay hidden under your skin. But remember, if you ever suspect you've got one, it's super important to get checked by a doctor to make sure everything fills up just right. So yeah, take care. Okay guys, so yun ang closed fracture. So sana may naintindihan kayo, and parang mabilis ako masyado, pero yeah, sana makakip up kayo. And ang next natin is Colles fracture. So ito yung sinasabi ko kanina na next sa closed fracture. So yung open, kasi 'di ba may dalawa, open and close. So mamaya pag-uusapan natin yung open. So sa next reporter. So next is Colles fracture. So hindi siya coolest Okay? So hindi siya maangas. Masakit siya. Okay? So, this is a fracture, guys. Take note. So, Colles fracture. Ito lang yung pronunciation sa kanya. So, it's basically a fancy name for a broken bone near your wrist. Yeah. So, why is it called like that? So, well, some sort of, smart doctor named Colles back in the day figured this kind of break is worth naming. So, yeah. Colles fracture. Okay. Baba to, guys. So, you know, dito na tayo. Dito na. So the Colles fracture, it's also called the distal, away from the center of the body. So see, so the distal radius in the end of the forearm, and this is where the hand is attached onto the forearm. So the distal radius is an extremely important bone structure in the wrist, guys. So the mechanism injury of a fall on an outstretched hand in certain patients over a more older age group in their 50s or 60s, possibly with osteoporotic bone, so they say. So even a low energy injury can cause what we call the Colles fracture. So which is the fracture of the distal radius, and this is the Colles fracture. So, okay. Ano nga ba ang osteoporosis? Osteoporosis is a medical condition, guys, characterized by the weakening of the bones. Paghina ng bones natin. Okay? So, making them fragile and more prone to fractures. Diba? So, the term osteoporosis can be broken down. Osteo refers to the bone. Osteo refers to the bone. Porosis means porous or full of holes. Ang dami siyang butas. So, essentially, it describes a condition where the density and quality of a bone are reduced. Okay, so here's the deal. If you take a hard fall and, try to save yourself by putting your hand out, the first can mess up is your wrist, right? So, syempre, nahulog ka. Ano pa bang alam mo na yun. So, the bone right at the end of your forearm, called the radius, gets the brunt of it. So what's kind of weird is, when you get a collis fracture, uh, you know, uh, your wrist and hand can end up looking like a dinner fork. So yeah, papakita ko dito, dinner fork, yung itsura niya. So no, seriously, the wrist bends backward, and the broken bone, the broken bone bit kind of pokes upward like the kinds of a fork. Basta pag ganun siya, makikita nyo lang dito. Pag ganyan yung fork, di ba? May paano siya, pa-curve siya dito. So, that's the dinner fork. Deformity they talk about. So, yeah. So, uh, what do you do if you think you've got one? Okay. So, paano pag nagkaroon ka yan? So, first, you'll need the doctor to fix it first. Di ba? Doctor muna. Hindi yung manghihilot. Okay? Huwag ganun. So, they'll either gently pop the bone back into place. So, guys, that's called reduction. So, or if it's really messed up, you might really need a surgery, guys. So then they'll wrap up your wrist and in case or a splint to get to keep everything steady while it heals. So when that's off, there might be some exercises to get your wrist moving like normally again. So may mga exercises na ibibigay sa'yo or tuturo sa'yo. So there you go. So collis fracture, a fancy name for a wrist bone break that can look like a dinner fork. Yeah. So just remember, if you think you've got one, get to a doctor, guys. Get to a doctor. So they'll get you fixed up in no time. So yeah, that's the scope of the collis fracture. So yeah, uh, next reporter. So ang tatakal natin ngayon sa next reporter will be what is this? The comminuted fracture, compression, green stick, impacted, oblique, open, pot, spiral, and transverse. So madami siya. Dami pa yan. Ganito. 1, 2, 3, 4, 5, 6, 7, 8, 9. So madami pa. Madami pa siya. So yun. Yun lang muna ang pag-uusapan natin. So next reporter. Thank you guys for listening.
Okay, next is the comminuted. It says here that it is a fracture in the bones in which the bone is splintered or crushed. Meaning, hindi lang siya simple na na-broke yung bone mo. Which is, example, is ito yung bone. Then, yung bone mo, hindi lang siya simple na-broke ng ganto. Which is, yung bone mo is na-tear into pieces. So, meaning kapag tear into pieces, hindi lang siya one, kundi two or more. Okay, next is the compression. It says here that compression is a fracture caused by force from both ends as to a vertebra. Okay, makikita sa video na to na yung spinal cord natin is may separate section na kung saan ay tawagin na vertebra. Each vertebra is called vertebral body na kung saan may outer shell siya na tinatawag na solid bone. And sa internal naman is tinatawag na spongy bone. Example na lang is kung may osteoarthritis ka, is mawiweaken yung bone mo if hindi na kayang suportahan nung bone mo yung daily activities na ginagawa mo. Kaya nagko-cause ng compression fracture.
And now, I will discuss the green stick fracture. A green stick fracture is a type of bone fracture often seen in children, where one side of the bone is partially broken but the other side remains bent or intact. It's named after the weyang. Flexible twigs can partially break without snapping completely. Treatment usually involves immobilization with a cast or splint for proper healing.
So next is the oblique fractures. It breaks occurs at the angle across the bone. Usually one fragment slips by other. Oblique fractures are most common fractures in long bones such as the thigh bone or the femur. Tibia, fibula, humerus or the upper arm bone, and the radius and ulna or the forearm bones. Oblique fractures are typically caused by high-energy trauma such as fall from a height or a car accident or the sports injury.
Open fracture is associated with open wound or broken bone protrudes through the skin.
Patch fracture. Patch fracture is a type of ankle fracture characterized by a break in the lateral or medial malleolus, one of the bony protrusions on the sides of the ankle. Sometimes both of these bones can break at the same times, usually as the result of a severe ankle pain. This fracture is being called by English physician Percival Pott, who experienced this injury in 1765 and described his clinical findings in a paper published in 1769. Pot fracture is also a fracture at the distal end of the fibula with injury to the tibial joint.
Hi everyone, my name is Mark Tester Panakan. I'm going to discuss the spiral fractures in a spinal or S-shape, usually caused by twisting injuries. That's all.
So moving on to the transverse fracture. As you can see at the picture that is shown, transverse fracture goes across the bone. It runs horizontally perpendicular to your bone. It is also referred to as complete fracture. This only means that the line of the break goes all the way through your bone. So there are two types of transverse fracture. So the first one is the non-displaced bone transverse fracture. As shown in this video, non-displaced bone fracture is a clean break across the bone that is still in its alignment. So the second and the last is the displaced bone transverse fracture, which is a clean break across the bone that it is moved.